we're introduced to the patient really early, it's actually really helpful. If they have a symptom, perhaps something like pain that's not well managed, it sort of adds value to what we can do. Other than symptom management, I think making sure that people are feeling well supported, liaising with district nursing who would see most of our patients, or the local rural nursing teams, liaising with the allied health team, physio, OT, speech language and dietitians as well is also a really important part. I guess you could say our role is a lot of assessment and then service coordination. We also work really closely with the GP practices and work to update them if there are changes in a patient's condition.
The one thing I think it's important for me is that I've organised my own funeral. I've made the arrangements. I've picked my songs. I've picked my casket. I've picked what I want my brothers and my sons to do, and then what I'd like the service to do. Palliative care now means I can be in my own home. I can be around where it's something I love, and they check on me. They're either on and they're only a phone call away. That's the real good thing. Yeah. If I'm struggling with something, and I'm not a very good person on drugs, I have a lot of reactions because don't have them, full stop. And we've had to, after chemo, we've had to find a way to manage the pain, which is and will get worse. I know that. Of having both the district nurses and the palliative girls, I can be at least comfortable, and I don't have to be in hospital, which is not a place I want to be. And it's no disrespect to the nurses, it's not a place I want. This is my home. This is where I'm comfy. This is where I can have my friends. They can pop in. I can potter in my garden, even paint it.
So knowing that Sharon, it's really important for Sharon to be at home in her own surroundings as much as possible. We've worked together with the district nurses to manage symptoms like pain, making sure she's got adequate supports, looking at what she eats. She's been coping with fatigue, which is part of any advanced disease, particularly cancers, and that's something that other people can't actually see.
I sit over there, and this here is my 21st present, Mum and Dad. They always gave us some money, and I picked that, and it's up the coast road, and as I've always lived by the beach, and that's where I go when I'm struggling, and I've always gone from a little girl. And I have my picture there, which my son drew when he was only in 4th form. And you really can't do it on your own. You need somebody. But you need, yeah, you need someone like you, or someone who knows you. I've had some knocks, but this is the one that no matter what I do, what I throw at it, and I'm a strong person, I'm a really strong person.
You've done well though, seriously.
Leaving my grandsons, and that's hard to swallow.